We're not starting from scratch. There's a lot of experience in making vaccines successfully against Ebola uh, viruses, but we need to start from the relatively early stages right now to expedite the development and availability of vaccines to address this current outbreak. A number of different approaches are being explored by different investigators. They're all based on platforms for vaccine development, which have been successfully utilized previously, and trying different platforms is important so that we can maximize our probability of success.
Can you say how far out you think a vaccine for the Bundibugyo strain is?
Well, the vaccine that we're developing, we hope to have into clinical trials by the end of this year, but those trials will take time to conduct. The other programs could potentially get to the clinic a bit earlier than ours, but it depends on what additional preclinical data they need to generate. But I think all of them will probably end up approximately in the same place at around the same time. So we would hope that clinical trials would be well underway with the different candidates by the end of this year. If for some of the other candidates, it might even be a bit sooner than that.
And are those trials happening on the continent? We talk quite a lot about how a lot of the vaccines that end up getting to the continent are not produced or manufactured on the actual African continent. Is that the same case for what we're seeing right now with the current program that IAVI is working on?
Well, I mean, IAVI's been working in Africa for, approximately 25 years, and a significant number of our staff are African and based in Africa. So for us, it is a normal course of our operations to do our studies in Africa if they're targeting diseases that impact African populations. And we also have a long-term commitment for those vaccines to be manufactured on the African continent. We established a partnership with the Institute Pasteur in Dakar, Senegal, for the manufacturing of our vaccines. That will take probably a few years to actually fully implement that partnership where the vaccines can be manufactured there. So we will be manufacturing them outside of the continent, at least initially, but intend fully to transfer them so they can be manufactured on the African continent. But for us, we believe it's critically important to do the clinical studies on the African continent and really have that be visible and understood by the communities there, and have it be done in partnership with African investigators and African communities.